Well, let's begin by bringing you up to speed with some of the top stories today. It's certainly not the best times for the country, but the Nigeria Center for Disease Control, NCDC, and other organs of government are doing their best to contain the spread of COVID-19. Sadly, this morning, Nigeria confirmed 2 new cases of COVID-19, one in Lagos and another in Osun State. Like in the recent past, both cases are set to be returning travelers to the country. As it stands today, Nigeria has 46 confirmed cases of COVID-19 in Nigeria. 2 persons have been discharged and 1 fatal. There's a breakdown of the confirmed cases by state, showing that Lagos has the highest number of infections with 30. The FCT 8 cases. Osun State has recorded 3 cases, while Ekiti, Oyo, Edo, Bauchi, and now Osun State have 1 confirmed case each. And now to the Vice President of Nigeria, Professor Yemi Osinbajo, whose result, according to the Nigeria Center for Disease Control, NCDC, has tested negative to COVID-19. Before now, he was in self-isolation in accordance with the NCDC protocols. On his Twitter handle from his aide, Mr. Laolu Akonde, it was established that the VP was observing social distancing and working from his home office. And help has come to Nigeria in the battle against COVID-19 as the prevention materials donated by Chinese billionaire Jack Ma to Africa has arrived the country. The first batch of 1.1 million testing kits, 6 million masks, 60,000 protective suits arrived in Ethiopia on Monday, March the 23rd. And a day after, Ethiopia's Prime Minister announced the materials had been shipped to some African countries, including Nigeria. And in a tweet Tuesday morning, the countries were listed. Nigeria has taken possession of the kits donated by the tech billionaire. Nigeria takes delivery of the test kits and personal protective equipment since it landed the country. 100,000 masks we hear it contains, and also PPEs. The Permanent Secretary, Ministry of Health, says there are 20,000 test kits to be distributed to the 5 laboratories in the country, 2 in Lagos, 1 in Abuja, 1 in Osun, and 1 in Edo State. Now, it was sometime in January 29th when Nigeria recorded its index case through an Italian who came into the country through the Murtala Mohammed International Airport, Lagos. Latest information from the Nigeria Center for Disease Control, NCDC, shows that Osun State has just recorded its first case, although the NCDC website did not indicate the identity of the case or whether male or female, and it isn't also clear if the person has been moved into an isolation center. Now to Ebonyi State. It's one of the states without any record of COVID-19. Even at that, the governor, David Umahi, has taken precautionary measures by ordering the closure of all schools, nightclubs, sporting activities, burial ceremonies, naming ceremonies, weddings from the 25th of March 2020. Other measures include that civil servants from grade 1 to 10 must stay off work, excluding health workers, from March 2020 to the 14th of April 2020.
We have closed all schools, nightclubs, sporting activities, and from 25th of March 2020, gathering of more than 50 persons other than in the essential service centers, such as markets, rice mill, religious centers, banks, hotels, and other essential centers shall be an offense. We have advised all religious institutions and all centers for essential service as mentioned above to provide nose masks, running water, and ensure that every person entering and exiting, which means that as you are entering these essential service centers, you must observe to wash your hands and put sanitizers. And if you exiting, you also do the same because you are also exiting to the public. And ensure that every person entering and exiting do wash their hands in the running water and use sanitizers. And also gaps, distancing must be curated among people within these essential service centers.
Well, for his counterpart in Plateau State, public servants in the state from grade levels 12 and below have been directed to work from home for the next 30 days, while markets are to be closed with only traders selling food items, pharmaceuticals, cooking gas operators are to remain open. And the state broadcasts to citizens on the pandemic. Governor Simon Lalong announced the prohibition of street trading and hawking as well as street begging.
Effect from Wednesday, the 25th of March 2020. All public servants in Plateau State from grade levels 12 and below are to work from home for the next 30 days. Only workers offering essential services such as security, health, media, street cleaners, and water supply and energy are exempted from this directive. In view of the crowds associated with markets, government is directing all markets to close effective 25th March 2020. Only traders selling food items, pharmaceuticals, and cooking gas are to remain open. In addition, all street trading, street hawking, and begging are prohibited. The weekly Sunday markets at Ahmadu Bello Way, Bukuru, and environs are hereby banned. Social joints, nightclubs, drinking parlors are to also close effective Wednesday, 25th March 2020. I have directed security agencies to begin enforcement, and anyone found violating these orders should be arrested. Should the situation continue this way, we shall not hesitate to impose a complete lockdown in order to save the lives of our people.
Now, from the Chairman Senate Committee on Primary Health, Senator Ibrahim Oloriegbe says the letter purportedly written by President Buhari's Chief of Staff to the President of Senate on the refusal of federal lawmakers to subject themselves to screening at the airport is fake. Briefing Senate correspondents at the National Assembly on Tuesday, he said the Senate President did not receive the letter from Mr. Abba Kyari. His explanation is coming following criticisms against some federal lawmakers who reports say failed to practice self-isolation after returning from the United Kingdom last weekend. Our correspondents have been following the various measures by state governments to stem the spread of COVID-19. Ekiti State government has one confirmed case of COVID-19, and according to the state's Commissioner for Health, the patient is stable. Here's our correspondent, Agbeyo Babajide, who brings us more updates.
Thank you and welcome to Ekiti State. Here, the situation is not yet alarming because only one case of COVID-19 has been recorded, which is the index case. But the state government has been proactive enough to take some measures. For instance, civil servants from levels 1 to 12 have been asked to stay away for now to decongest the state secretariat. And that has been complied with substantially. We've been to the market, the main market in Ado-Ekiti, still quite congested. But some have been observing the social distancing order and some are still erring. Here at this location, we have a large crowd of people wanting to travel to other states. The state government provided buses to that effect in the last 3 days, but today those buses are not available and, well, the people will have to find their way. We'll give you more updates as events unfold. Babajide Agbeyo, Channels Television News.
Latest from Ekiti there. But joining us for more on the level of awareness in Nigeria and also efforts of state governments to indeed curb COVID-19 is Dr. Adenike Oguntuwase. She's a member Association of Medical Officers of Health. Thank you for coming on the program. All right, now let's begin from this first case in Osun State, because according to the record of the NCDC in terms of isolation centers, we don't appear to have one in Osun State. Does this give you concerns?
Yes, Ma, but even if you don't have an isolation center, you can develop one as soon as possible. A general hospital can be converted into an isolation center. All you need is the necessary equipment to take care of the patient.
But looking at the cases we're seeing from the beginning of the first index case to this point, do you think we're prepared? And if things should get out of hand, do you think we can manage things?
Yes, we're prepared. In Lagos State, we're considering converting even the National Stadium into an isolation center. Every local government should bring up a primary school that will be used as an isolation center. And currently, the IDH is still there.
In terms of federal government measures, we have several state governors saying, let's close the market, except essential food items, pharmaceuticals. Do you think there's certain other things they need to put, or measures they need to put in place to ensure that we really contain the spread?
People should stay at home. Anybody that does not need to come out should stay at home.
But that's a difficulty, because staying at home would mean you probably would eat more, you need a lot more things at home. And so in terms of, people's livelihood, it will be affected as well.
One person can go to the market, only a member of the home, and when the person comes back, there's a way he enters the home, leaving his shoes out, and he contaminates everything he's bringing in, such that they won't be infected. So there will be food. How
serious should Nigerians be taking this? Some people are saying, we're looking at just about 46 cases, maybe 43 active cases. Is there a problem of contact tracing? Do you think that this number, even though confirmed, might actually be more than we know?
We are tracing all the contacts. Currently, I'm coming from the field for contact tracing. Everybody that arrives in Nigeria or contact of any positive person that the person mentioned have been here or have had close contact with this person, will follow the person up, will drop a thermometer with the person and tell them not to even go to a facility, but to call us back when they develop any symptoms so that they don't transmit it to other people and stay at home for the next 14 days.
Are there some reports that you've gotten about people who are refusing to self-isolate even though they came in from some of those high-risk countries?
Well, we have gotten some reports whereby neighbors have called that, my landlord's daughter just came back from abroad and she's going out. Then we'll go and educate such person, or we'll call and tell them the importance of staying at home. Even within their home, they should maintain proper social distancing so that if they become positive, their family members will not become positive.
Do you think state governments should take stronger measures like arrests? For example, in Jordan, if you're not social distancing or self-isolating, they come and pick you up.
Yes, and that even happened on Sunday. On Sunday, remember that they said churches should not have more than 20 people, more than 20 people should not gather in a particular place. Initially, it was 50. So the environmental health officers, health workers, including LNNC, went out to enforce that. Some churches were closed. They told the people to go home. And I even learned of a worse scenario in Surulere where they locked the gate, that they won't even go anywhere. So there's already enforcement. And if you are under self-isolation and you go out, there can be enforcement.
All right, we'd like to appreciate your time. Dr. Adenike Aguntuwashi, Member, Association of Medical Officers of Health, the front line fighter in this pandemic. Thank you for joining us.
Thank you.